Joining me now are two veterans who can speak directly to the challenges of transitioning into civilian life. I'd like to welcome to the set Silvestre Asadillo and Brad Gagnon. And they are working directly with you, Deb, correct?
That's right.
So tell us a little bit first, Silvestre, I'd like to begin with you. Tell us about the branch of the military that you served in, and then I'd like to hear a little bit about what your process was like with transitioning out.
Well, I was in the United States Navy. I started actually as a Navy corpsman. I don't know if you know what a Navy corpsman is, a medic.
A medic, okay.
Transitioned into public affairs. And by the time I was retiring, I was trying to start my own business, which is in printing and graphic design. So I decided to move here in DC because I didn't want to go back home to San Francisco.
So where were you stationed at the time that you were transitioning?
I was stationed in Yokosuka, Japan. That was my last station.
Wow.
I was there for almost 13 years, actually, in and out, because stations are like 3 or 4 years, depending on you're single or you're married. So that was my last station. So I was processed there, actually, and that's where my...
When you say you were processed, you're put through some sort of a procedure where they...
It's called transition program for retirees and people that are getting out as well. They're put together. There's no differences between you're getting out or you're retiring. You're put together in this program for about 3 weeks that allows you to prepare, basically supposed to be to get out, where you want to relocate. If you relocate to another place that's not your home station, that's not your home of record, it's called home of record, which is where you joined. I joined in San Francisco, but I didn't want to go back there. I wanted to come to DC. So they prepare you all the paperwork, the VA if you have a disability, and I had a disability, so they prepare you in there. But most importantly, what they try to do is allow you to prepare economically. The job, resume, they help you with that if you're trying to get another job somewhere out.
So that sounds like a lot of really important life decisions to make in a 3-week time period. Yeah, that's pretty intense.
It's by the time we got to the second week, I realized that it was more of a check mark. It's not really. There was no. Sometimes people would ask specific phone numbers that they want to connect with to the city or the town or the county where they want to relocate, and they had no idea.
So when you got to wherever it was you ultimately wanted to end up, in your case, DC, was there any system for you here?
It was easier for me because DC is one of the main transition centers. The VA is here. There's 2 major bases here where that can help you. Bethesda for Navy, Fort Belvoir for Army, I think. Right? Yeah, so that is easier for a lot that people move here, but there's a lot of people that want to move back to a little town in Ohio, a little town in Wisconsin. They don't have those training centers. They don't have those transition centers.
So when they arrive, the branch of the military that they were in pays for them to travel to wherever their home is. And when they get there, what happens?
You're on your own.
You're completely on your own.
You're on your own. So if you have some missing part of the application process for the VA, you got to get to the main VA processing centers.
That's closest to you.
That's
which
closest to your zip code or your centers, which is, in our case, there's only 5, I think, in the whole country. LA, DC, there's one in New York, and I think one in Nashville. I actually was in Nashville for 3 weeks because my home of record was sent to Nashville.
This is crazy. This is just crazy.
It's amazing. Yeah.
Did you have the same experience, Brad, when you transitioned?
Luckily, when I got out, I had a little bit of help from the DAV, but the TAPS program that you spoke of, it's pretty superficial, and it can't possibly cover all of the stuff that you would hope to in a matter of weeks, knowing that your life is going to change. My situation getting out under medical, it was not expected. I expected to be a lifer, but...
And you were in what branch of the military?
I was in the Marines.
Okay.
And I was right here at Quantico. It's a superficial program. It's not ideal. You can't base all your plans off that TAPS program. You have to make your own, and if you're not ready, that TAPS isn't enough to get everything in order.
So what happened for you once you transitioned?
I didn't expect to be getting out. I was lucky to have some headhunters from a company owned by Ross Perot, former presidential candidate, come in and actually they had a file on me somehow, but they had asked me to go work for them. So I was lucky that I had that support system, because if I had gone back to Vermont, where we talked about, I would have ended up going over to New York.
Is this where you were from?
Yeah.
Okay.
Because there's nothing in Vermont. There's no veteran services in Vermont to speak of. I would have ended up going over to New York and working with that.
So, Silvestri, when you transitioned out, you said you ended up in D.C., so things were a little bit...
I wanted to be in D.C.
You wanted to be in D.C.
So I've always wanted to be here because I have dreamed of being a part of government service, so politics.
So what happens to those vets, at least in your experience, because both of you are volunteering, or you're working with Deborah in Operation Renewed Hope, and you're volunteering
whenever
with
I can,
in Operation Renewed Hope. What happens on average to these veterans that you described who maybe aren't as lucky as you? Maybe they don't end up in a place where there is a facility that can provide them with support. Deborah, when you see these vets, how much time has transpired between the time they transitioned and they actually show up as being somebody that you need to help?
Usually for us, the homeless veterans, it takes about 6 to 12 months for them to run out of their savings and then get into the desperate situations.
6 to 12 months. You know what? It sounds like it's a long time, but it's a really quick period of time to go by, especially when you've come out of the structure that you've had in the military to sort of, you're on your own. You're on your own.
Yeah.
Tell us a little bit, for either of you, what was that feeling like when that happened for you?
I can imagine it depends a lot on the type of job that you were in. I was communications electronics, and there's a lot of things that you could go into with that, but it's also very specific to a certain kind of electronics. I mean, if you're infantry, where are you gonna apply that? There may be a large gap of time where you're looking for a job that you can support your family if you have one, or that applies to your set of skills, or trying to adapt to something else because your skills don't have a civilian application, such as infantry. You know, say you worked in a tank or AAVs. Where are you gonna put that?
Yeah. So Deborah, do you notice in the vets that you're helping that there tends to be, I guess what I'm thinking is a spiral of events that starts to happen once they run out of the funds, and then something else happens and something else happens, and it seems like it's really hard to keep that snowball from rolling downhill?
Absolutely. You know, I've spoken to over 500 veterans, and I can probably tell you about 500 different stories. It could be a medical issue that led them to that spiral. It could be a death in the family. It could be a divorce. There's many reasons for it. But when you're in the military, when you're active duty, everything is taken care of for you. When you get out and you don't make the same amount of money, whether it be the same type of job or not, you know, it doesn't take much time to fall into that situation, 6 months or 12 months, depending on how much savings you have acquired.
And Brad, when we were talking earlier, you were telling me about essentially that same kind of thing happening for you. It started to be what sounds like a bit of a spiral, one thing and another and another. Share a little bit of that, because I think people need to understand the complexity of this experience.
Well, when I got out, like I said, it wasn't expected. And you know, I was kind of thrown to the wind. I'd expected to be a lifer, you know, get my lifer mug and be a Marine. That's all I wanted to do. Regretfully, medical issues cut that short. The way I got out, I didn't get the benefits that I should have gotten through the DOD, because certain things weren't tracked during that TAPS process. Certain things were missed. The TAPS process is probably leaps and bounds better now than it was.
But sounds like a ton of things fell through the proverbial cracks.
They did. I got out at 10%. They refused to test for certain things like diabetes, because I was having some health issues at the time. And my identical twin brother was already diabetic and tested that. And I said, hey, you know, can you test that? They refused. So when I got out, I got in touch with the DAV, and I told them, you know, what I had given them. I went from 10 to 70 immediately, because adult onset diabetes, hypertension, all of these things that if they had been appropriately tracked, documented, diagnosed as requested while I was in, would have changed the whole adventure getting out. I would have had DOD benefits and some assistance in transition, and I didn't, because the way I got out, even though the DAV is great and I can't recommend them enough, those DOD benefits getting out are gone. So I have benefits through the VA, but it's definitely not the same.
And when you talk about 10 to 70, are you talking about in terms of the percentage of disability?
Disability.
Okay, so
And it affects your compensation, your access to medical care, your your accessibility to school programs, going to college. You have to be a certain percentage for each of these things.
Each of the benefits to kick in.
Right, and if I had, I think probably the biggest thing that I miss is if I had gotten out with DOD benefits, go to the commissary. We would have done all our shopping at the commissary. There's just so much that's different about getting out through the DOD with documented issues rather than going through the VA.
So in the transition process, did both of you feel a sense of identity loss when you woke up one day and you weren't a Marine anymore? I know once a Marine, always a Marine, but when you're not wearing that uniform anymore.
It's actually more of a question mark that comes into, because now suddenly you're considered a civilian. Tapping up on what he was talking about, you're receiving variable housing allowance. Somebody's paying for your rent. Somebody's paying for your water.
Medical.
You don't have to pay for anything. Your children have the toothache or a heartache. You bring it to the clinic, to the hospital, to the base hospital, and there's no question. There's no line. There's no asking for what is your insurance, and those are taken care of. Suddenly, you're out there in civilian life. In your first week, you could actually feel that. Because,
first week.
Yeah, because now you have to go to who's your primary healthcare provider, who's your dentist, who's your eye care. If you have children that needs all of this, this is your responsibility now. It becomes actually your responsibility. And when I started as a corpsman, and we managed this health records that's the key issues of how this thing goes wrong, is that when they're transitioning on TAPS, you're required to go there every day. 8 to 5 or 7 to 3. Well, if you have a medical issue that you need to take care of, you can't go to the clinic, because if you miss that, you have to redo the whole thing again, or they won't sign you off. But you have to take care. You're supposed to take care of your medical record, because you're supposed to do all your medical examinations right before you get out. You have to do your final physical. You have to do your dental exam, and that goes for every member of your family if you're retiring, or if you're getting out, if you're married, whatever is your family in there. You can't handle all of those.
Yeah, so it sounds like it's pretty complex,
Yes,
and there's not enough.
Once you get out, you're expected to report to the VA. Well, how are you going to pay for that if you're living in a little town
And the VA is
Maine,
thousands of miles
in
away.
Different state.
Yes. So a lot of this homeless that ends up in Deborah's care or attention, they've already started a process a year before. Little by little, running out of money. And then if you're single, you end up living with your mom back again at 45, 30 years old, and traveling far away to get your medical exam, because you're fighting for that percentage. And that happened to me. I started at 30%. Had to fight for every 6 months, write letters, appeal, in order to get higher and higher, which is...
And it's not to take advantage of the system, and I think that's important to point out. It's not so you can take advantage of the system, it's so that you can get from the system the support you need.
Yes.
And if you're going to try and milk disability, the VA and the military is not the place to do it. That's a battle. Everything's a battle and a heartache with the VA, and it takes forever.